Welcome to This Explainer. Today, we're diving into a deeply personal memoir about the harrowing early days of the AIDS crisis. But this isn't just a medical history. We're going to explore how one doctor's search for purpose proves that your greatest perceived flaws might actually be exactly what the world needs. Let's get right into it.
We're anchoring our entire journey today on this single idea from Sir William Osler, who's basically the father of modern medicine. Happiness lies in the absorption in some vocation which satisfies the soul. Keep that in the back of your mind, because we're about to trace how one eager, frankly, hyperactive medical student navigated immense tragedy, clashed with elite academia, and fought through fierce political battles just to find that exact absorption Osler is talking about.
Part 1. The Urge to Protect, Racing Against a New Plague.
Our story starts at the very beginning of this doctor's career. He didn't just want a job, right? He was fueled by this deep, almost instinctual urge to protect vulnerable people. And think about the sheer whiplash of this era. It's 1982, he's a 19-year-old teaching assistant, and he first hears rumors of this terrifying new disease reaching bubonic plague proportions. He's in such a mad rush to become a doctor and help that he actually takes this wild detour to attend medical school in communist Poland just to get his start, before finally landing in Manhattan in 1991 to face the epidemic head-on.
But here's the thing about our narrator. He is definitely not your typical compliant medical student. He's got this hyper, fiercely protective personality, and he constantly questions authority. He absolutely refuses to just follow orders blindly. I mean, he pushes back so hard at one point that he gets slapped with a 3-day suspension simply for asking his superiors why about a routine blood test. He wanted to know what they were actually going to do with that information, not just blindly document it. It's a trait that gets him into hot water early on, but keep it in mind because it's going to be absolutely crucial later.
Part 2. Ground Zero of AIDS, Confronting the 100% Death Rate.
Walking into a Manhattan hospital in 1991 meant walking straight into ground zero. The medical community was up against something utterly terrifying, a disease with a 100% death rate and literally zero effective treatments. Every single day, the young doctors witnessing profound tragedy. Some of the most talented people in our culture are being brought in. He's treating an opera singer struggling with dementia, a landscape artist who has gone completely blind, a trombone player with tumors on his lip. It felt as though the virus was intentionally destroying in these patients the exact thing they loved most in the world.
And then, the historical facts crash into profound personal empathy. The narrator had this amazing mentor named David. David was this brilliant California cool critical care director, just fiercely dedicated to his patients. But then, David suddenly disappears from the hospital. Our narrator tracks him down, only to discover the heartbreaking truth. David himself has secretly contracted AIDS. Seeing his absolute hero devastated, lying in isolation like a ghost, it forces the young doctor to confront the absolute ruthlessness of this epidemic on an incredibly personal level.
Part 3. The Wrong Fit, Navigating the Elite Halls of Sloan Kettering.
So, devastated but entirely determined, our doctor finishes his residency and lands a highly coveted fellowship at the world-renowned Memorial Sloan Kettering Cancer Center. But, as we all learn eventually, prestige doesn't automatically mean you found your calling. The contrast here is wild. On one side, Sloan Kettering is described as a vitreous chamber, completely insulated, immensely quiet, elite, stoic. It's a sanctuary for quiet research. On the other side, you have our author. He's loud, impatient, leaning heavy into activism, constantly asking uncomfortable questions, and proudly wearing a red AIDS ribbon in an environment that strongly discouraged singling out specific diseases. It is a massive, fundamental personality clash.
He's working under Dr. Donald Armstrong, an absolute giant in the field. And this quote from Armstrong really highlights the intense, stoic dedication of that old guard. When I came here, my friends were going to NASA to put a man on the moon. I came here to eradicate cancer. But despite sharing that intense drive to find a cure, our narrator's loud, disruptive style just rubs the institution the wrong way. It eventually culminates in this absolutely crushing evaluation where the faculty tells him he is the least knowledgeable fellow they have ever trained. And why? Simply because he asked too many unconventional questions.
Part 4. The Baby AIDS Bill, a fierce political battle for public health.
Feeling totally lost and rejected by elite academia, his entire trajectory shifts. A landmark medical study comes out showing that giving the drug AZT to pregnant mothers drops the HIV transmission rate to their babies from 25% all the way down to 8%. Suddenly, there's a tangible way to prevent death. But this sparks an agonizing societal dilemma.
Assemblywoman Nettie Mayerson starts pushing a bill to make it mandatory for hospitals to at least offer HIV testing to pregnant women so they can get this life-saving AZT. So, on one side, you have the argument, what mother wouldn't want to save her baby? But on the flip side, the AIDS activist community views this as a massive invasion of privacy. They're terrified that automatic offering is a slippery slope right back into mandatory testing without consent, which would violate the strict civil rights they had fought tooth and nail for during a time of immense, awful stigma. And this creates an incredibly fiery legislative clash. Two deeply vital ethical positions slamming into each other. You have Assemblywoman Mayerson desperately fighting to save infants utilizing these brand new medical breakthroughs. And opposing her, you have the highly organized ACT UP protesters who are disrupting scientific meetings, screaming, and throwing buckets of strawberry syrup to simulate blood, absolutely terrified of the loss of patient confidentiality. It's a profound conflict, and our author steps right into the middle of it. Part 5. A Vocation to Satisfy. Finding Purpose in the Underserved Clinics. Leaving the quiet, elite labs of Sloan Kettering in his rearview mirror, he takes a job as a medical director in an underserved neighborhood in Brooklyn. He is suddenly taking care of marginalized patients, far, far away from the prestige of his fellowship. And you know what? A funny thing happens. He actually starts to feel happy. Think about it. In elite academia, his traits made him feel ignorant, he got suspended, he was told he lacked knowledge. But in this community clinic, he feels indispensable. His loud, impatient, confrontational personality suddenly acts as a massive shield for his vulnerable patients. The very traits that made him a total disaster in a quiet research lab made him the absolute perfect champion to go up to Albany and scream right back at the activists to get that baby AIDS bill passed. And his relentless, loud advocacy actually worked. The baby AIDS bill passed in New York State. The impact of that was immediate and, frankly, breathtaking. Almost overnight, the number of children born HIV positive in New York plummeted from 2,000 cases a year down to under 200. Over time, through a combination of widespread testing and medication compliance, transmission rates eventually fell to less than 1%. The New York rule was soon adopted nationally, and pediatric HIV was virtually eliminated in the United States. His sheer inability to sit quietly in a laboratory directly facilitated his role in helping to save an entire generation of children from a fatal disease. It's just incredible. Bringing us full circle back to Sir William Osler's quote, our doctor finally realizes his true calling. He was never meant to be a quiet lab researcher. He eventually leverages his hyperactive, information-sponging personality to become one of the world's most prolific authors of medical textbooks and an elite educator. He finally found that sweet spot where his unique, loud talents were exactly what was desperately needed by students and patients alike.
To wrap up this explainer, I want you to look at this remarkable journey and ask yourself one final thing. If you are out there grinding away, working hard, learning, trying to do the right thing, but you are still just not succeeding, is it really because you lack ability? Do you need to change how you work, or, like our doctor, leaving the elite labs for the community clinics of Brooklyn, do you simply need to change where you are working to find the exact place that needs your unique gifts? Think about that for a while. Thanks so much for joining me to explore this incredible story today.